responsible marijuana policy. We obviously couldn't do it without the grassroots action going on across the state to reform marijuana laws. It's such a beautiful thing to see developing and refining itself. As you can see, looking around you, this isn't the fringe group that you see in the news, burning down a bowl. These are professionals. These are lawyers, parents, business owners that want to see sensible policies in Texas. So give yourselves a round of applause. Our coalition, the website TexasMarijuanaPolicy.org, for anyone who hasn't visited it, our coalition is developing, and it's bringing together Democrats, Republicans, Independents, Libertarians, all working together on an issue that they agree on. 77% of Texans, according to UT and the Texas Tribune, are in favor of marijuana law reform in Texas. And I think the great showing that we have today is demonstrating that. And we're going to demonstrate that to our legislators, that we want to see sensible policies, responsible marijuana policies implemented in Texas. And our two priorities, decriminalization of small amounts, because people should not be going to jail for small possession of marijuana, and safe and legal access to medical marijuana for patients who are sick and can benefit from this natural medicine. So today is incredibly important because we are taking it directly to our legislators. As you know, legislators only meet for a very short period of time every 2 years. So it's very intense, and it is important that we are represented at the Capitol building. Lobbyists are there all day. Bless people are lobbyists. Nothing bad on lobbyists generally, but they represent lobbyists and bureaucrats that are there every day, and it's time for the people to start showing up, and that's what we're doing here today, to get down there and to talk about the real reasons why we want to see these laws changed. And from a personal perspective, it's important to be building relationships with these folks. Hopefully this isn't the first time that you've communicated with your legislator. Hopefully you've sent an email, or you've made a phone call. Maybe you've met with them in their district office already, and now we're demonstrating at the Capitol building how many of us there are and who we are that want to see marijuana laws reformed. And everyone is looking so good. I just want to emphasize that again. It's so good to see you all today. The professionalism is such an important element of this, to be taken seriously and to see the policies changed in Texas. So I would like to just review very quickly the folder that y'all have. And I'm going to grab one while y'all open it up. Is this better? Can y'all hear me a little better now? All right, so on the left-hand side, we have our agenda for the training that we're going to be going over today. We're going to go over Capitol culture and etiquette, what you can expect and what is going to be kind of expected of you to really represent the cause as best you can. Maps, because the building is huge. We have the largest state capitol in the country. It's a beautiful building, but you can't get twisted around easily. So we do have maps. We are going to be in teams, so you don't have to be intimidated, and Jax is going to go over that with us. The legislative process can be a little bit daunting. It is a lot of work. But overall, there's lots of opportunity for the people to be involved, for the grassroots to have an impact on policy changes. Zoe Russell with Republicans Against Marijuana Prohibition is going to be going over the legislative process for us. And then I'm going to go over the two priority policies that we have, which I mentioned briefly, decriminalization and medical marijuana, our two priorities for this session. Decriminalization, the bill that we want to see introduced is CPAS is HB 507, and I just noticed that Representative Moody, the author of that bill, is here with us today. Thank you very much, Jimmy. Talking about it. And then we're going to wrap up with a little bit of role play. So we're going to just kind of go a little back and forth on what it's like for your first legislative visit, what the staff member's likely to be like, kind of the points that we want to go over. And as we go through the day, make a few notes of the things that you want to talk about with your legislator. The first thing and most important thing is really humanizing this issue, talking about your family, yourself, introducing yourself, being, born and raised in the district and going to Leander High School, if that's, really let them know who you are and why you have roots in that community and why, they should be listening to you as a constituent and as someone who is engaged in their community. And then we have our our policies, and I have overviews on the right-hand side of HB 507 and then of a comprehensive medical marijuana program, the kind that we want to see implemented in Texas. And so this is going to give us a little bit of information about those policies and some information. For example, in Texas, over 70,000 people are arrested every year, and at least in 2012, for marijuana offenses, 97% of which were for simple possession. So we're not talking about dealers, we're not talking about people trafficking, we're talking about people that possess this plant, a substance that is objectively safer than alcohol, and for patients, many of the prescription drugs that they're being prescribed by their doctors. So that's one of the little tidbits of information to help you to fall back on, and maybe identify a few of these that are most important to you that you can bring up during your meeting. And then the second page is the medical marijuana. So you can talk about the different organizations that are on board. Recently, the American Pediatric Academy came out in favor of decriminalization and research for medical marijuana. The Texas Nurses Association is on board because of the tremendous benefit that patients can see, particularly with the use of with chronic pain, with severe pain. We're seeing pain specialists. As we know, narcotics and hydrocodone are prescribed and abused. And in states that have access to medical marijuana, overdose deaths on opiates is down 25 to 33%. Overdose deaths and accidental deaths. We're talking about people who accidentally took too much because they're prescribed it, they have pills there, and people are choosing this natural medicine when they have the opportunity. So that kind of information that's important. One other thing that I'll just mention with regard to medical marijuana, a lot of legislators, a lot of Texans don't know that you don't have to smoke marijuana in order to receive the benefits. Obviously, you shouldn't go to jail if you choose to smoke it, but there's lots of ways that you can consume the benefits of this natural plant without smoking, because if you're not a smoker, you're not going to want to smoke, but there's lots of opportunity, and that's where our manufacturers come in, and having an industry, entrepreneurs, thinking of innovative ways to get this product to the customer and to the patient. So all that information is there on the right-hand side, those two overview documents. And then I breezed over it, but the maps on the left, which is what Jax will go over, and an overview of the legislative process. I think that's all that's in your packets. However, we're going to be breaking up into teams, and your team leader has the packets that we're going to be delivering to legislators. The one-pagers, which you have a copy of, but we also have them printed in color, really nice for legislators. A little bit of information about medical marijuana if they serve on the one of the health committees. And then an overview of HB 507. Everyone's getting that because we're going to get that passed this year. And we want to make sure that they see it from us. We're going to go through our training with this first session. I know we planned on doing Senate Districts 1 through 15, and then a second session with 16 through 31. But we have two big buses that are a little bit behind. Obviously, traffic and parking and everything getting down here on a weekday. So they're going to be in the second session. Obviously, this is the first one. So we're going to go through it, and then we'll break, and we're going to welcome y'all to stay and mingle with your team leaders and get to know each other, kind of get your own personal game plan. If you don't feel like you need a team leader to kind of hold your hand, if you're confident enough, get the packet from them, and you can go and do your meeting on your own. There's the information for their room is on an index card, which is paper clipped to their packet. And so you have everything you need to give to them. Go through the meeting. When you walk in, you're just going to ask for a few minutes of their time to talk about either medical marijuana or just say an issue that's important to you. And then you'll move forward on that. But we'll talk a little bit more about that, and we'll let Jax Finkel come on up and talk about capital culture and etiquette. Welcome, Jax.